Hi, this is Dr. Taylor. I'm going to talk about understanding your shoulder. So you have shoulder pain. Right? The first thing you have to understand is that the shoulder is more complicated than you think. You can see here that you have about 8 different muscle groups at least that connect to the shoulder. More like 12 plus, right? So you have the humerus, which is your arm bone. Then you have the shoulder joint, which is called the glenohumeral joint. Then you have the scapula, which is your shoulder blade. And then you have your collarbone, which connects to it. And then you have all these muscles that connect to the shoulder. The upper trap, the rhomboids, the posterior rotator cuff, the latissimus, the deltoids, the supraspinatus, which is the most commonly torn rotator cuff, the subscapularis, the bicep, the tricep, and so forth. The number one thing you have to understand with the shoulder, okay, especially if you have shoulder pain that's been present for many months and you haven't had an MRI, or you have had MRI and sure enough you have a torn rotator cuff tear. Number one, it is possible for you to not go down the surgical route. I'll say that again. It is possible for you to not go down the surgical route. If you choose to do so, that's your choice, based on your orthopedic doctor's recommendation. But if you choose not to, it is possible for you to not go down the surgical route. You just have to be gentle with anything you do. Even with physical therapy, exercises, you have to be gentle. You do not want to suddenly tear the rotator cuff. You have to ease your rotator cuff back to health little by little, gentle by gentle, right? Number 2, stability. Right? So you have to make sure you promote stability in your shoulder by learning proper exercises. You don't want to just stabilize the shoulder. You want to stabilize your whole scapula. Back here, that's the anchor of your shoulder. So stability is key. And then number 3, you want to work on getting comprehensive therapy, right? Chiropractic care to the neck and back. Comprehensive laser, shockwave, myofascial therapy to treat all the surrounding areas. If you do a comprehensive treatment of your shoulder, not just focusing on the pain, but focusing on everywhere around it, you will get the best results. This is Dr. Taylor on understanding your shoulder.